YouTube and a bunch of other platforms so that we can extend our audience. And
All right.
so thank you for our patience while we're doing that. Yeah, we're excited about it. And so and so thanks for being here for our lunchtime, healthcare tech talk as well. Today, the topic is something that's I'm a little bit passionate about over the past weeks. It's this concept of the experience economy in the context of healthcare. And so providing, a better experience for the patient, the provider, and the member. And so it seems like there's a lot of big trends that are sort of happening in healthcare right now, but two that stick out a lot to me are the things that we hear about on a daily basis that are happening with data science, machine learning, and some would put that under the umbrella category of AI. But then the other thing that I've been hearing a lot more about recently, especially with what we've gone through in the past year and a half, and that's this idea of the patient experience. Now, the patient experience. I think that another thing that's propelling this is the boom in telehealth, right? So, much like work from home and collaboration from home was probably it was already happening, right? But then when we had these issues with the pandemic, it just sort of boomed, right? Some people would say, well, we harnessed 10 years of collaboration and work from home technology and, in 12 months, right? The pandemic, it just sort of. And so I would submit that the same is true for telehealth. I think telehealth was already taking off and more and more people were doing it. But then with what happened in the past 18 months, there's been an explosion in telehealth, right? So more and more patients are accepting of remote visits, and that remote visit often starts by registering in a patient portal of some sort. And so what that's done is it's not only propelled telehealth, but this concept of experience, right? And at the same time, we're seeing this Microsoft build on this in other areas of their technology stack. With Teams, for example, they talk a lot now about the employee experience, right, within Microsoft Teams. And so what's interesting is I was asked to do an article recently for a healthcare community, and so I came up with this idea of putting down some thoughts around this patient experience and provider experience and member experience. And so that's the long intro, if you will, why I'm so passionate about this particular topic in healthcare right now. It started really by looking at what SAP was doing. So at the same time, we've had this explosion in sort of cloud in general in the past year or two, because we've all had to work remotely. And a subset of that has been these industry clouds, right? And so we've seen SAP, for example, focus on an industry cloud offering in healthcare and automotive and in different industries. And we've seen Microsoft focus on the industry cloud. They've also announced 5 industry clouds, one for healthcare, automotive, finance, and some other ones as well. And so all these things are sort of coming together, if you will. And if I had to add actually one more piece to that that's making this patient experience possible, it's that these vendors that have these industry-specific cloud offerings now, so that would be SAP, Microsoft, Salesforce, Oracle, IBM, one of the things that they have in common, besides the data and the analytics and the AI piece, is that they have some sort of CRM-ish background, right? So if you look at, for example, the Microsoft Cloud for healthcare, they have it wrapped around Dynamics, right? And the idea is that, and for the patient, along the patient stuff, they actually use the service features in Dynamics. And so what's happening is you're seeing this evolution where years ago we would talk about patient access and making sure that patients had access to healthcare. And now we can extend that, and we've talked about it in the context of the journey, right? The patient journey through healthcare, what does that look like? And now I feel this has become even more encompassing in that we talk about the patient experience, and not only the patient, but again, the provider and the member as well. And so even more of I think like of a second introduction into the topic, if you will. And so if you look at what I started my research with SAP, and it was interesting to see how much they're building on this experience economy, right? And so you can see right up front, they're talking about health from health engagement to experience. And so, the idea here is that the engaging patient experience happens across multiple interaction channels. It's happening up front now. What's happening is patients are starting the experience by using bots now. They're going to, the big one is portals. I was reading an article that was published by one of these research companies, and they said one of the other things that's happened as a fallout of this pandemic in healthcare is that it's propelled the patient portal. So prior to the pandemic, we had patient portals, of course, they were a popular topic. People were starting to use them, but not like now. Now it's like people have no problem going up to a portal, starting their experience with the provider remotely. I do this in my own healthcare system.
Hey, Paul.
Yep.
Are you sharing your screen? We cannot see.
Oh, thank you for that so much.
No worries.
I should be sharing my screen. I was only showing a web page, but that's still good to show. So all I was doing was I was on the SAP website when we were speaking.
Got it.
And so this is the section I scrolled down here at the bottom. You can see they're actually using this term patient engagement, and then patient engagement to experience. So again, the portal, a lot of this will start at the portal, and it could start with a bot. So one of the other underlying technologies that's really sort of driving a lot of this, including telehealth, is omni-channel communications, right? So now if we're going to start the patient experience, not only with the possibility that the patient might start with a phone call, but they might actually start the triage process and registration process, if you will, through a bot experience. There's also the chance that they might want to interact through chat on the portal, right? Email would be another channel I would submit. And so absolutely, omni-channel has become a critical underpinning to the success of telehealth, and I would submit the overall patient experience, right? Because not only is it going to start in the very beginning many times now, where patients are using omni-channel communications to start their experience with their healthcare provider, but then on the other end of the spectrum, on the other end of the experience, we have patients have the ability now to have these devices, these medical devices that are just giving out tons of information, literally second by second. My watch, this Garmin watch is literally streaming health statistics. I'm just guesstimating there's at least 20 of them. I know there's at least 2 or 3 that stream live, like my heartbeat, my stress level, that is streamed live, and I can get that up on my phone anytime, right? So now we have the patient who's engaging and starting to interact with their healthcare provider through omni-channel, through the patient portal, et cetera, starting that patient experience. And then as they continue the journey in the experience, again, you have these devices where patients can access at home, the watch. I've got the Wi-Fi blood pressure cuff that I've been playing around with. There's the SpO2. I've got a Wi-Fi SpO2 sitting around here, and literally it transmits the data into my phone and then into a data set that I can send out to the doctor. So all of that data at this time, there's not a lot of great integration. If I want to share that with my doctor, I'm actually, in some cases, I'm doing screenshots. I'm doing cut and paste of screenshots of the data, and then I'm actually uploading it into a patient portal so that my provider has access to it. And so that is a real world example. That's how I interact with my provider today. And granted, I'm a technology person and I build some of this stuff, so I'm a little bit more excited about this patient experience than most, if you will. But this is again, it's a real world example, and just as somebody that's newish to the Boston area, I do in the in the fairly recent future, go through this process of starting my experience with my providers here. And that experience started with a bot, then into the portal. And now I try to do almost all of my communication that I have with my providers now is either through the portal, and it's amazing how much they use omni-channel and text now. I get text confirmations about every appointment. I get reminded by text of the appointment the day before, and then I'm asked to confirm by typing in confirm, and it confirms the actual visit with the provider. And now I understandable. I understand that Boston is known for its world-class healthcare technology, and we're I think it's fair to say maybe we're a little advanced in our acceptance of this technology, but nonetheless it's here. It's coming to your community soon, even if your local hospitals are don't necessarily have these state-of-art portals. But the interesting thing is that most of them, especially the larger hospitals and the healthcare systems, absolutely already have this in place, or at least have a plan where they're piloting this stuff. And one of the reasons that makes this possible is that it's really a handful of vendors at the top that are making this experience, working on this patient experience, if you will, right? One of the other, so that's SAP. Take a look at SAP. They're doing some really cool stuff in Industry Cloud. In the interest of our time here, I want to make sure I can show other ones. I'm not going to spend too much time on them, but here's another great example. If we look at Cerner, who recently partnered with Salesforce, right? So, if we look now, they've actually have a new app called Healthy CRM, right, by Cerner. And so essentially what that is, it's the partnership of Cerner, which if I remember correctly is the number 2 medical record, second largest medical record provider in North America. I should say in the United States. Cerner has partnered with Salesforce, right? So that's a huge partnership. And notice they've actually built CRM into the name, right? Healthy CRM. So what they're focused on with this partnership is bringing the Salesforce, the business apps, the customer relationship part of their expertise, and partnering that, marrying that to the healthcare record, so that you can be treated like a human, like a customer. Imagine that. Because sometimes that's not the experience. I don't know how often you visit your doctor or
I feel the same.
Yeah, it can very easily not feel like a human, right, in today's healthcare system. So I think this focus on patient experience is great. What's also interesting is it crosses providers, right? Everybody has a compelling offering that's maturing. And I say maturing because I don't think any of these folks have the perfect answer yet. I think they're all doing some jockeying. There was even some news recently that Microsoft might purchase Cerner, or one of these companies to compete with Google. One of the things I learned recently, just recently, in the last couple of weeks, Google gave some concrete information about their intro into healthcare, and it's really quite impressive what they're doing. They've actually partnered with one of the largest healthcare systems in the country, and I forget the name of them now. I want to say AMC, but I know that's wrong. I just have that in my mind because AMC is in the news so much. But they partnered with this healthcare system, and now they are, they're essentially adding their patient care app, which is, the bulk of it is a set of sophisticated machine learning algorithms that essentially is going to surface the patient data up to the clinicians, right? And so the idea here is that they're going to use machine learning to put the appropriate data in front of the patient at that point in time. That's incredibly impressive. I mean, and what's interesting about the Google strategy is that they're bringing what they do best to the game, right? Which is this idea of these machine learning algorithms, which they just really do well in that space. They really do. A lot of people are I think it's safe to say, following and chasing some of the stuff that Google does in the machine learning space. And then they're adding, and then search, of course, right? That's what built the company, is search. And they're adding that on top of millions of patient records, right, with this healthcare hospital system. And so the end result will be this care studio that providers will be able to use to not only manage the information, to be able to see the important information first, but think about the power of having that data set. Now they can have algorithms behind the scenes that are running to come out with predictions for population health, etc., right? Or triggering a notification or an alert, based on some sort of data and machine learning algorithm, right? Maybe it's diabetes, for example, population health and diabetes, right? So I'm really interested in what Google's doing. Check it out up here, tying in again to the patient experience. And then I've talked about Microsoft multiple times. Microsoft is they're getting information out to partners now. They had their partner conference last week. They were beat up a bit because they don't really have much out there yet for partners. That's changing. We're starting to get little peeks into what their vision is, but essentially they're sort of following the Cerner Salesforce sort of model, if you will, and that they can wrap their experience around dynamics. They can include teams in that, which is, certainly a powerful thing. And then of course they have data science as well, and I think they're going to, hopefully they'll tell us more of that story over the next weeks. Amazon, same thing. I felt like Amazon, actually, they probably have the least compelling story to tell out of the three larger clouds, right? From an experience perspective, don't get me wrong, Amazon's doing some amazing things, supporting data science and supporting research, and they've done some great work with partners. But when we look at what Amazon is doing compared to what Google is doing, compared to what Microsoft is doing, in my opinion, Google and Microsoft they just have a lot more pieces to the overall puzzle to offer in healthcare, if you will. A lot more pieces of and when I say that, to be more specific, for example, if we again look at Microsoft, you have the business apps and the CRM piece and Dynamics. You have the team side for collaboration. Then you have the Azure data science stuff and data lake, right? Synapse services, to help with machine learning. And then if you look at Google, the same thing, right? With Google Care now, and then they've got Google Looker tied in. They've got and then of course the power of their machine learning and data science. So just quick observations on my part. So IBM, another niche player in this market. I'm not sure if I would go as far as to say that IBM has an industry cloud, but I keep bringing up IBM because what they do have that is a niche market is their blockchain offering, right? And what's interesting is that as big as blockchain is around the planet, we try, for various reasons, we continue to fight it in the West, in the United States. But the reality is that IBM is the only one that's willing to go out there and talk about blockchain. I think the other cloud providers, you can understand their hesitancy, right? Like cloud and blockchain are two different things. You can do one or the other, and so you might submit that some of these blockchain apps would be competition for cloud apps, right? So blockchain doesn't run on the cloud, or at least it shouldn't. And so for that reason, I think some of the cloud vendors are a little bit hesitant, to talk about it a lot. And so I guess that's how I would open up the conversation. I would be interested just to hear what other thoughts folks have about the patient experience and how you're starting to see that. If we need to compare and contrast it to other industry as well, that would be great. So again, yeah, I think I would just open up the discussion at this point and see if anybody has any thoughts to share. Thanks. computer had to drop.
You guys have any questions, Juan or Bonnie, or something you want to share?
Okay, that's fine.
Yeah, go ahead, Juan.
You hear me?
Yes,
Yeah.
now I can.
Oh, hi, Paul, and hi, Tian. I think it's amazing the resources that legal providers offer to work with healthcare. I'm just starting with the science and it's useful tools for this.
Yes. Where are you based out of, Juan?
Where are you from?
Oh, I'm from Mexico.
Well, okay.
Okay.
The reason why I ask is we just had a meeting prior to this user group about the healthcare community in Mexico.
Yeah,
And-
with the he I think you're part of the student ambassadors, right? Or
Oh, okay.
I'm wrong?
Nice. Well, welcome to the group. I am sorry.
Thank you.
Yes, I think I interrupt you. If you want to finish, I apologize for interrupting.
No, Paul, that's all.
Okay. Well, we are very inspired by your work and the community work that you are doing and starting in Mexico, and we are very much looking forward for our groups to work together and our communities to work together. And I appreciate you taking the time to make our meetings. It means a lot. Thank you.
Thank you both for your time and for sharing knowledge with us.
Of course. Okay, so then I think, do you want to stop the recording?
Yeah, I'm gonna stop. So thanks everybody for joining us and participate. It was really good. And well, we'll see you next week. Yeah, I'm gonna finish the stream. Thank you so much.